guys? Recovering from the surgery. I look like dog shit, but I'm good. Just in some pain, but that's the name of the game. And you know, just in recovery and gonna get through it. Still feel loopy from the anesthesia, but it hurts to talk. But I gotta keep people updated, understanding what's going on with the surgery and everything. And hopefully, if someone has to get the surgery, this will help them out a little bit to understand. So I got a dressing on my neck where they took out the left side of my thyroid. So now I'm just gonna stay overnight to get monitored. Make sure there's no excessive bleeding or anything, but anesthesia sucks. But that's it. I'm sure I'll add to this video, so take care, guys. Thyroid surgery in the books, baby. Second day, got the surgery yesterday, and guys, I lied. I didn't get half my thyroid removed. I got neck implant surgery, so I can have a fat ass neck. You know what I'm saying? Look at that shit. Dude, I think I came straight out of the NFL. I'm doing good. I'm eating a lot. Tons of bland food, but it's good. I just had some coffee, and I'm gonna get out soon, probably in like an hour. So I'll add another video to it, but it just hurts when I swallow. My voice is a little weird, but it's getting better. So I'll keep you guys posted. Rest of Your Perception podcast, post thyroid surgery, thyroid cancer surgery. See you later, guys. Of thyroid cancer removal surgery. So yeah, shitty night, but I'm in pain. You can see that there's bruising and there's swelling in my chest and in my neck, but I'm home and, getting through it. Casey, even though she's going through her Lyme disease shit, she's stepping up big time. And it's rough, but we're getting through it. I can't lift the kids or do anything really for like 2 to 3 weeks. So, but I'm recovering, I'm outside, I'm breathing, I'm moving around nice and slow. So, day 3, keep you guys posted. And if you have any questions, just reach out to me. Rest of Your Perception podcast, baby. The struggle is real. Take care, guys. Day 4 of thyroid cancer removal. So I had the left side of my thyroid removed, and it's day 4. I'm recovering pretty well. I just saw the surgeon today, and he said that everything is good. So far, so good. Just waiting on the pathology report. So we'll see if it's spread anywhere or spread to cells. Normally with this type of cancer, it's slow moving. So that's a good thing. So we'll see what happens. Whatever it is, we take in stride. And right now you can see my swelling went down. I bled a lot because, you could see all the bruising and stuff, but I bled a lot, and I have bad bruising because I was moving after the surgery, and I had nobody there to tell me not to until a nurse came up and said, "What are you doing?" I started turning my head, and that caused it to bleed. My body, the reason why you see the bruising is my body's absorbing all the excess blood. But other than that, everything's good. So far, so good. It's a lot easier to eat. As you can see, like during the days, my eating was, the day of the surgery, I was eating. So, but yeah, day 4. See you guys tomorrow. What's up, guys? Day 6 of thyroid cancer removal surgery. and I'm doing a lot better, much better. I could eat a lot easier, I could talk easier, I can move a little bit better. I'll show you the scar, or the healing scar, what's going on. Get ready. Looks like pretty gross, but yeah, see, I'm swollen all right here. This is where they use the stitching gel. Dermabond, I guess it's called. I'm not sure if that's exactly it. But yeah, I'm doing a lot better. I'll cover it back up so you guys don't have to look at it. But I'm doing a lot better, and I'm feeling a lot better. And I'm gonna put another video up attached to this one on what I use to help me recover, besides help from family and friends. So, all right guys, day 6, take care. What's up guys? Day 7 of thyroid cancer removal surgery. Yeah, I'm waiting in line over at Walgreens to pick up some prescriptions for my wife. So I'm feeling a lot better. My neck is still super stiff. You can see the bruising is still there around the surgical site. It's very weird, but you know, it's the name of the game. And I'm wearing my my last button-down shirt. Yes, it's a Santa Claus shirt. No, it's not Christmas, but every day's Christmas for me. So yeah, just moving up a few inches in line because I'm in the drive-through pharmacy. Yeah, anyway, I'm getting a lot of mobility back in my neck. You can see that. Stretching. Don't do what I do. Not that it's bad that I'm doing this, but do what your doctor recommends if you're looking at this for info on how the surgery goes. Not medical advice, but just insight on the surgery. I got my left side of my thyroid removed, and guess what? My pathology came back, and I'm negative for any other cancer. It didn't spread anywhere. It was localized to that one spot, which I'm very fortunate and I'm very happy to find out. So that's a big deal. Even though thyroid cancer is generally not very aggressive, sometimes it is. And I know somebody personally who has it metastasized. So, you know, it sucks, but I know that person will fight it and beat it. But I got very lucky here, and I'm very fortunate to be in the position where I'm at, and I was able to salvage half my thyroid to hopefully not go on thyroid medication in the future. So it's been exactly 1 week. The swelling has went down a lot. I still got a lot of bruising, but bruising ain't shit. All right, I'll keep you guys posted. What's up, guys? Day 14 of Adam's apple removal surgery. Just kidding. It looks like it though. You still can't see my Adam's apple. Thyroid cancer removal surgery. So yeah, sorry you're looking at the ugly surgical site. It's still swollen and bruised, but it's getting better. Sorry I got a sweaty face, but I just got out of the sauna. I just started doing it yesterday on day 13. And right after, I go in and I take a cold shower just to help to reduce inflammation and just get my blood flowing, because I can't really exercise, but this actually helps. So in the next video, I'll explain everything I did to try to recover and make myself as comfortable as possible after the surgery, because as good as doctors are and as good as surgeons are, they don't really give any tips on how to recover. It's pretty general, and it kind of sucks. And as talented and skilled as surgeons are, they don't tell you. I guess because they don't know. I don't know. But I'm going to give you the tips that I used, that I got actually from my wife, because she's been through a bunch of surgeries. And if you guys know her history, she's a strength and conditioning coach. She has a bunch of recovery certifications. She's been doing this for a very long time. She's helped multiple women from breast cancer-related surgeries, cancer-related surgeries. So surgeries all fall in a category that if someone has knowledge about it, they could help you recover. So I'm not recommending this to anybody. I'm just telling you what I did to help me recover. So I still can't go back to work yet because I'm still pretty limited. I can't really lift my head up. It's still pretty tight around the surgical site. So I'll give you guys an update
on the next video on everything that I used to help me recover. So take care, guys. What's up, guys? We are at 18 days after my thyroid surgery. So day 18 of recovery. So obviously you saw in the previous videos that I had half my thyroid removed along with some lymph nodes. So to finalize this video, I wanted to go over what I did post-surgery to recover. So again, I'm not recommending anything. This is just what I did. If you take ideas from it, great. It's just to help out so people understand what they're getting themselves into. I went into this thinking that it was going to be pretty easy. After 2 weeks, I'll be back at work, be back on the truck, and I'll be good to go. But it wasn't like that. My surgery, post-surgery, I bled a lot. And I think it was because I had half my thyroid removed as opposed to the whole thyroid. And I wanted to salvage it because I didn't want to go on medication for the rest of my life. So my voice has changed a little bit too, so that's a little weird. Anyway, but I might go on medication in the future. We don't know, but as of now, I'm good. I feel good. I'm getting better. I did very light exercise today. My mobility in my neck is still pretty limited. I could turn my head, just not fast. You could see the ugly surgical, it's not a scar yet, but the wound, it's pretty swollen still, but it's taking a while. I'll cover it up for you guys. It's taking a while to heal just because there's a lot of trauma to that area. I mean, my thyroid was cut in half. So, and then along with me moving my head after the surgery, because I was all messed up on anesthesia and whatever other drugs they gave me, Versed and whatever, I started moving my head around thinking like, oh, I'm okay. And that's when I bled more, which wasn't good. But it happens. People are stupid. I'm one of them. So anyway, this is a list of what I did to recover and what I'm still doing. So, I mean, obviously there's some things I don't need to do anymore because I'm getting better. So, you know, here we go. First thing is when you get out of the hospital, you're probably going to spend the night in the hospital, you got to get something to sleep upright. In the hospital, they got a reclining bed, so that helped. It's uncomfortable either way. With sleeping upright is weird, but I could not lay back. Again, this was me because of my situation, my swelling, everything that I had that was going on. I could not lay down. I felt like I was choking, okay? So I had to stay upright for about a week. So get yourself an upright, one of those weird pillows, or I don't know if they call them study buddies or whatever, and you can sleep upright. I slept on my couch for the first 3 nights. That sucked. The sleep for the first 3 nights is shitty. That's the name of the game. I didn't take pain pills. I chose not to because I don't like being constipated. And I've had to take pain pills before after my eye surgery, and it sucked. Constipation from anesthesia and pain pills is terrible. And I think it's worse than the pain post-surgery. That's just me. It does hurt when you swallow food. It's going to hurt a little bit when you drink, but mostly swallowing food. But I was hungry and I still ate. I was fine. You know, I didn't skip a beat with eating, so that's good. Okay, so we got the upright pillow. Wear button-down shirts. That helps a lot. I still choose to wear a button-down shirt. You see my previous videos that are attached to this one. I wear it to sleep still, like you know, like an old timer. You know, getting your little pajamas with your button down and a little hat with a pom pom at the end. No, I didn't get the hat, but yeah, button-down shirts help a lot. Okay, I used an airplane pillow. That helped me. If I was sleeping, I turned it one way or turn it the other way. Airplane, those little donut airplane pillow things, half donuts, they help a lot. Drink from a straw. I drink from a straw a lot. That helped big time because I still can't really tilt my head back 100%, but you're not going to be able to do that. It's super difficult. So to open up your throat, like after every bite, I would have to go like this up until like 10 days after the surgery. I was doing that. So, all right. I use an eye mask to sleep. because it just helps. I used it in the hospital, or I put a t-shirt over my face. I don't really particularly like eye masks because the elastic band is tight on my fat head, but you can get a loose one, but if you're sleeping upright, it's difficult to put a t-shirt over your face or a piece of cloth to cover your eyes, but that helps with sleep anyway, regardless, no matter where you are. Blacking out your area, if you can't do that, an eye mask or something over your eyes helps immensely with sleep. I can't stress it enough. I do it at the station for the firefighters out there. I put something over my eyes when I go into my bunk to sleep, and that helps big time with getting back to sleep and staying asleep. So I took a turmeric and curcumin supplement. I guess it helped. I don't know. I took that. I took my multivitamins. I took my fish oil. I took vitamin D and vitamin C. I took a high dose of vitamin C. I don't know if that's anything. I hear it's good for cancer, anti-cancer. So you can get something called absorbic acid that's very high in vitamin C. I mean, I think a half a teaspoon, you can get 2 grams of vitamin C out of it. So, you know, it's 2,000 milligrams. So do the math of how many teaspoons you can get. It's super sour when you mix it in water. So, yeah, I took that. Motrin, I took Motrin, like 600 milligrams a day. Listen, do whatever your doctor recommends. This is just what I did. I went and I sat outside in the sun and I walked around in my backyard barefoot. You know, people say grounding, it helps healing, negative charge in the ground, this and that. I believe it. I think it helps with blood flow, going and walking around in the sun. I liked it. It helped me. It helps boost my morale. It helps me get a little bit of blood flowing. So I like that. When I was in the hospital and also when I was laying down at home, I would pump my feet. I'd pump my fists. A few days after, this is just in the blood flow topic, I would move my head very lightly just to try to get some movement and blood flow in my neck, moving up. So I can't even look up all the way. Sucks. But it's getting there. It's just still tighter on this site, the surgery site. But I would do that. I put a lacrosse ball against the wall, and I would massage my traps because my traps are super tight because I'm guarding. I'm forward because everything is tight right here. So my wife had me do these exercises that help with that. So give me a second. So yeah, I did that. As far as getting blood flow, I didn't lift my kids or anything. I didn't lift up any heavy objects for 2 weeks. So, and I had a fruit and vegetable smoothie every day. I ate, what else? I had red meat. I had bone broth. That's just me. That's what I like. That's what helped me. Listen, I don't know what helped me recover or whatever. I'm not some fucking superhuman because I'm recovering. It's day 18 and I can't go back to work. So, I also drank, because this is a big thing, like I said before, with constipation. I drink lots of water. I drank a greens drink from First Form. It's called Optigreens 50. I don't like it. It tastes terrible. I haven't taken it for a year now. And it's got a lot of good stuff in it. I took that and I took Metamucil the first few days. Shout out to my partner, Keith. He got me on the Metamucil. So Metamucil, and day 4, I had a bowel movement. So, yeah. It was easy, though. Easy. For people that have had surgery before, this helped me a lot. So Metamucil and a greens drink. And just probiotics. I was also drinking kefir. So there's probiotic supplements that, you know, these pills that are a lot higher in probiotics, like the amount. It goes by the billions. But what I took, Metamucil, the greens drink, and I didn't mix them. I took them, you know, throughout the day. That stuff helped me with constipation big time in the end. When you get your first bowel movement after surgery, everybody knows how fucking shitty that is. No pun intended. But yeah, it helped. Okay? And the chamomile to help with sleep. The first 3 days, listen, if you take your pain pills, they're going to help you sleep. I don't like the way they make me sleep. It makes me feel weird and loopy, so I didn't like it, but they will help you sleep. The chamomile helped me sleep, not with pain, but it just helped me relax. So I drank chamomile, and probably the biggest thing that someone's going to need after this surgery in particular, or any surgery, but this is what I'm talking about, the thyroid surgery along with the lymph nodes, is physical help. You need physical help. You need all hands on deck, especially if you have kids. Get family in there to help you. If you got to pay somebody, get them, because it was a different situation for me. My wife is going through medical issues as well, which I've discussed in previous podcasts, and it wasn't easy. I had family members help, my parents, my father-in-law, my brother. I've had, I had people, those are the people that helped me. And obviously my wife stepped up big time, even though she's going through it, So the biggest thing is physical help. And I'm going to leave it there. That's it. I hope you guys got something out of it, out of this whole surgery discussion that I had. So I hope you enjoyed the videos, seeing the progression from the day of surgery to now. So, all right, guys, take care. Episode 45 of the Wrestle Your Perception podcast. Take care, guys. So, another addition to the video. Also, I forgot to mention is breathing exercises. After getting the ET tube down my throat for the anesthesia while the surgery was going on, post-surgery, it's difficult to cough anything up because a lot of times, there's some trauma to your trachea. So it was, I was coughing up a little bit of dry blood or whatever and mucus. So I would make sure to do like 5 minutes a day of breathing exercise. And I would breathe in for 5 seconds, hold it, like diaphragm breathing. Look that up to learn how to do that. Well, I did diaphragm breathing. I would hold it for 5 seconds, release it for 5 seconds, try to empty out all the air out of my stomach, well, out of my lungs, but, I'm basically pulling in my belly button to my spine as much as I can to try to release everything out of my diaphragm. And then I'd hold that empty for 5 seconds and I would release it. And that actually helped with expanding my lungs, increasing blood flow. So that was another thing post-op that helped me a lot, because it's hard to cough. It hurts, obviously, when you just had something cut in your neck. So that's just another tip that I did that helped me. Breathing exercises. Hey guys, a few more things I forgot to mention in the video. I used ice packs also on the wound site and around my neck where there was swelling. I used ice packs to help with the swelling. It helped with the pain. I also used a heat pad after a few days. So that also helped me a lot with recovery and just soothing the site, and it just makes you feel good. On and off with ice packs, the heat pad after a few days. The ice I could put on immediately, but the heat packs I did after a few days. I had an electric heating pad. Another big thing is sleep. Get as much sleep as you can, even if you're taking naps. I know it's going to be hard to get sleep after the surgery, but getting sleep, like every day I would wake up and I would feel a little bit better after sleep. Even if it was shitty sleep, I would still wake up and feel better than I did the next day, the previous day, and the swelling would go down. So sleep, ice, and heat. Can't stress it enough on the sleep. And that's with everything. Get as much sleep as you can, rest as much as you can. But sleep is definitely the #1 thing, and I can't believe I forgot to say it in the video. But, all right, guys, take care. Get out of my face.